So it's just by way of housekeeping. I was looking for that saying, and I found it where Sun Miao says it. I think it's such a nice saying. I wrote it here. Calm your shen, erect your jur. That is erect. So calm your mind, erect your will, let go of your e. And in this case, the e might be said, let go of your ego, and not just your intellect, but let go of your ego. Initiate your kindness and hold back nothing. That's the way to encounter the patient, according to Sun Miao. It's such a nice saying. When we talked about Ding Li earlier, Ding Li, direct translation, Li here is a knife with a handle, so it's force or power, and the Ding is said to be settled. It's like that walking foot radical, like settled. And the Buddhists borrow this more Taoist term of Ding Li and translate it as the power of samadhi. In Sanskrit, there's samadhi bala, the power you get with meditation as you become stabilized. And that's what the Ding Li is. And a nice definition is this one: freedom of preoccupation with our own internal dialogue. Confucius' statement on Ding Li is to let go of your thoughts, opinions, and worries. That's what builds your Ding Li. So just referring back to that thing we talked about, I noticed those statements on the break. Might like that. Okay. Oh, wait. Oh, too fast. So we've been talking about the Taoism, the Buddhism, the Confucianism in the Da I Jing Cheng of Sun Miao. Let's for just a moment get clear again on those traditional philosophical schools or spiritual schools or whatever. And the 6 schools, the categorization of the ancient philosophies of China into 6 schools, not including the Buddhists, are, first off, the Taoists. The Taoists are said to be the naturalists of philosophy, always looking to nature to try to glean what is natural order. We see this Taoist influence in our medicine in the terms of things like trying to behave in accordance with the seasons. When the days are longer, we should be more active. When the days are shorter, we should sleep more. We should eat seasonally available foods. These are sort of Taoist contributions, as well as the idea that we should always strive for contentment. Being content with what we have, not pursuing relentlessly material goods. This is a very Taoist influence. We see it referred to a lot in the Neijing. The Taoists say things like, even if you were to lose a kingdom, it may be regained at some later time. But if you were to lose your life, never can that be regained. So this is sort of, the Taoist says, the true Taoist is the one who lives in his small village and has never left. Not because he couldn't, he just never wanted to. That would be a Taoist attitude, right? So we have the Taoist influence in our medicine. Then we have the Confucian influence. Those were considered the scholars, the literati. They often have a saying that people who are Taoists when they're out of power become Confucians when they're in power. And the Confucian thing is about correct relationship. So the Taoists are about natural order, the Confucians are emphasizing social order as our guide. Rather than following the rhythms of nature, we should look to those natural relationships, parent and child, ruler and subject, friend, relationship with friend. These are the emphasis of Confucianism, to look to how to maintain those correct connections. And then there were the cosmologists, or the yin-yang school. They were all about looking at the sky and looking for those kind of rhythms. They were the astrologers of ancient China. It's quite interesting to look at their writings. For example, they often talk about, you have the ancient observatories, and they would record the conditions of the day, the weather, what the clouds look like, whether there was fog or not, and then they would stare into the sky to record the nature of the qi. it's always so interesting what they were seeing when they'd look at the chi of the sky. They would record this in detail for every day, you know. And so they were the ones who came up with a lot of these patterns that we use in Chinese medicine, you know, this kind of structuring patterns come out of the school of the cosmologists. Then there was the school of names. It's a very interesting tradition. The idea that all chaos could be avoided if things were just named accurately. Everybody gets on the same page because they talk about everything in the same way. Everything means the same thing to each person then. I mean, we do see so much conflict arise from this, don't we? That people, you know, they're arguing just because the way they're defining something is different. So the school of names is all about, let's get clear in our speech, in our understanding, in our categorization, and this would help us avoid conflicts. You have the school of names. Then you have the Moists. These were the temple guardians, and they were all about emphasizing benevolence. I mean, in a way, they have a very Confucian nature, but they were considered to put more emphasis on how do we to develop benevolence in our interactions. So these were the 6 traditional Chinese schools, with Buddhism as a 7th coming in from abroad. It came into China very early, in the early BC period, and then we see it go through many evolutions. There was a point in China when, you know, they had a very esoteric form of Buddhism, very akin to Tibetan Buddhism, before it was actually practiced in Tibet. And then, because the temples became very rich and very elaborate, that esoteric Buddhism was disbanded by the government. And so we see a shift. That's when you see Chan Buddhism, the more Zen style of practice, become emphasized, because the Chan practitioners didn't want to have an elaborate temple with ritual implements and all of that. And then the Mongols took over. Suddenly Tibetan Buddhism comes in. And so you see advisors to the Mongol rulers in the Yuan dynasty bringing the influence of Tibetan Buddhism back in. So you see this kind of influence of a more esoteric Buddhism with a lot of ritual, fall into disfavor, rise again, you know, after the... So you see that influence kind of changing its nature as the dynasties change. So those are the main schools of thought, just to be clear on those. I'm trying to look at, Confucius had his idea of applying the measuring square, which is pretty much our Western golden rule, right? That you should always think about your actions, seeing how those would influence you applied back to you. So you know, that sort of golden rule kind of thing is the principle of applying a measuring square that Confucius would attempt to emphasize. The legalists, I want to mention them one more time because they had such an influence on our basic structure of Chinese medicine. The legalists said that there are 3 forces to be applied: power, control, and law. You know, and that the emperor exerts his power in order to elicit control, and he does that through strict rule of law. The legalists were in some ways quite progressive because they felt laws should apply to all equally. So this idea that there were more aristocratic classes who were above the law and so forth was not a legalist idea, even though later we do see the application of legalist thought in the communist times. In fact, Mao Zedong liked to quote legalist philosophers, saying that what he was doing was often an application of a traditional Chinese philosophy, the legalist, but I'm not sure as I observe it that it was really everyone equal under the law, which would be the real application of legalism. They said that legalist philosophy is like taking bitter medicine or opening a boil. It may be uncomfortable, but it really heals the disease. You know, so we remains to be seen how is legalist philosophy the one that holds chaos at the most abeyance? Okay, what I'd like to do now is move into our next aspect of spirituality. I said earlier that spirituality has both the side of what is the history of spirituality in China, but also it has the side of application in modern practice. And in your handout packet, I started with this discussion of spirituality by asking some questions. For example, what is spirituality, and then what is religion? How are these different? You know, spirituality, I think, is a general recognition of a wider perspective. One definition given here is that it provides a sense of meaning and purpose beyond sort of the limited self-view. Versus religion, which may have a much more rigid set of beliefs, a rigid set of practices, may focus you. I mean, when we look at the term in the West, religion comes from the Latin religio, right? A relinking. A relinking with what? Has to be some notion that there is a finite way, a deity or whatever, and you're going to link to that. That's religion. This is different than spirituality. And so I think we can have spirituality. And in fact, I would argue that most of what is in China is not religion. The attachment to deities was minimal. Buddhism is actually more philosophy than religion. At the higher levels, Buddhism rejects the notion of any kind of deities, really. All has to be done for yourself. Confucius is saying, let the spirits take care of their own. I have much more trouble dealing with men. You know? So the Taoists, now there did become a kind of religious Taoism with temples and ritual practices and the like. But Taoism, in its more philosophical form, as we tend to think of it, led by Lao Tzu and Chuang-Tzu and those kind of thinkers, is clearly not a religion. There's no deity to relink with. So I think what we're seeing in China is generally more a spiritual perspective than a rigid religious kind of tradition. Now, at some point, there did become these deities, as I say, the ancestor deities and things, and there was some view that it really begs the question, if it's true that we're not focusing on deities so much, why was ritual behavior thought to be important? Remember that the emperor could delegate any activity. He didn't have to do anything because he was the emperor, except he had to conduct the seasonal rituals. Because it was felt that ritual behavior was a way of ordering qi. It's what kept things in balance. So when the emperor appeared on a certain day at the correct temple, Beijing is a good example of this. Once the capital moved to Beijing, it was set up with the directional temples. There's the temple of heaven in the south. There's the temple of earth in the north. There's the temple of the moon on one direction, the temple of the sun on the other. And his job was at the different seasons to appear at the temple dressed in the right colored robe for the season, to walk in a certain direction, to say the right things, to make the offering. Because in doing so, it wasn't so much that he was propitiating some angry god. It was that he was ordering the qi between heaven and earth, because there were three equals. We said Chinese thought, Chinese medicine follows a numerological thinking. So we have oneness. Then we have yin and yang. Then we divide it into three. As we cut yin and yang, we always made the third. Well, the level of three was heaven, earth, with man in between. All three equals. Man's behavior interlocked heaven and earth. So by the emperor doing the rituals as the representative for all the people in the kingdom, heaven and earth stayed in balance. Therefore, you wouldn't have natural disasters. The orderliness of the universe was maintained. So, for this reason, if there was a natural disaster, it was the emperor's fault. He didn't maintain order. I think we should apply this level of analysis to all political figures. If you can't control the orderliness between heaven and earth, you can't be president anymore. One very historical example of this is twice the Mongols tried to invade Japan, right? Both times, the emperor went to the temple and prayed, did ritual behavior, again, not praying to some specific deity, but trying to bring order, and in doing so, there was a typhoon that sunk the Mongol fleet. the name that was called the kamikaze, the divine wind, was called up by the emperor's ritual behavior. That was his job. He was supposed to be able to do that. You know? There was an invading force coming. The Japanese didn't have a navy. The Koreans had a good navy. They were bringing the only reason they couldn't land was because the divine wind stopped them. The emperor of Japan, that was his job. We got an army, but they're not very good. But we got you. You know, you can control the balance between heaven and earth. It's an interesting way of thinking. All traditional peoples have this. Right? The Native Americans have this. Right? Their ritual behaviors were about maintaining orderliness in the world. So this was the purpose of ritual. So Confucius put a lot of emphasis on ritual. Even said, I don't care about the spirits, but I care about ritual because it maintains order. Think about that in modern society. People always had ritual, did ritual things. Like in their family, there were certain things you did, and every season, you know, all the holidays, observances and stuff. There were all these ritual things that somehow lend a certain orderliness to people's lives. As those break down, I think people miss them. I think it leads to a certain kind of social disorder. We don't have the transition rituals in kids' lives anymore. There's no marker for when expectations change on you as a child and so forth. So I think lack of ritual in modern society does lead to a certain kind of mental chaos. I certainly think so with kids. Right? You see, all classical societies seem to have this. There are certain transition rituals marking when the expectations and responsibilities of children change. You're now at this age, you're going to go through this ceremony, you're then expected to behave a certain different way. And now, you know, kids are 26 and, you know, and it's still like, don't get a job yet, go to school more. And, you know, this is our society. And so it has a certain impact. So maybe that's something we also have to do as practitioners, is we try to impose a little orderliness on people. Maybe we do it with our treatment, with our interaction with them. We make the chi more orderly. I certainly feel we do that with kids when we treat these hyperactive behaviors and such. You know, also something I like to say is we often treat people to make them tolerant of their circumstances. People can't change their job a lot of times. They have to do that. That's, I mean, you know, they're there. Could we, I mean, we could say, oh, your job is a big cause for your dysfunction. But we can change their chi movement. It changes their thinking. They can tolerate their job. They can tolerate their boss. And we often do it with children. We treat the child, they can tolerate their parents. Because very often, we can recognize the cause of the dysfunction in the child is the parent's nature. The kind of discipline they do, or lack of discipline, the kind of structure they create at home. It would be nice if we can change that. People like to idealize. I hear teachers do it all the time. Oh, you can recognize when it's improper discipline from the parent. You should counsel them. You should treat the parent. Try it clinically and see how far you get. People, they don't know. I mean, they often only react out of the way they were taught, and their parents didn't do it right. And you know, so, but we treat the kid, and the kid just starts to be able to tolerate their parents. For example, no discipline causes liver qi stagnation. That liver qi stagnation turns to heat, and you get hyperactivity. So it's right what teachers say. Undisciplined kids get hyperactive. This is true. Can I tell the parent, exert more consistent discipline? Yes. Can they do it? But can I move the child's liver qi, prevent it from getting stagnant? They can tolerate that parent. Who's trying to do a good job, just their nature doesn't suit. So this is what we're often doing, I think, is we're treating the patient to tolerate their circumstance. As their body becomes more, their qi movement becomes more balanced, they can tolerate the circumstance. Anyway, so we're looking at what is spirituality versus what is religion. Does life have a purpose? These are questions that patients often are struggling with, and maybe part of our job is not just to order their chi, but to be a partner in this quest that they're making. After all, we say in Chinese medicine, if the person has strong Shen, their disease will be easy to treat. And when we say in this context strong Shen, it doesn't mean is their heart strong necessarily or is their consciousness strong. It means does their consciousness have strong direction? So if a person has strong direction in life that they feel good about, they're pursuing something, they feel good about it, they feel their life has meaning, their Shen will then be, they often use that metaphor of the Shen being a rider on the horse of Qi. If the Shen is strong, they're a good rider. They control their Qi. This means they make better choices, their body, they have better intuition, spontaneously they tend to do the right thing for themselves. But what if you're a rider on a horse and you don't know where you're going? How can you make the right choices then? After all, what is the right diet? It varies based on your condition, but also on where you want to go. Like I, for years in California, treated the state powerlifting champ. I mean, his diet, from most perspectives, is pretty crazy. I mean, how many egg whites can you eat for breakfast? Like 14, he was having and stuff. Is this a good diet? Not for me, but for the state powerlifting champ, maybe. But could he feel and make better choices if, since he had a goal, clear direction in his life, I'm going to be the state powerlifting champ, I'm going to pursue that, that's what I want to do, that's what makes me happy, that's how I feel actualized in my life. I think he was able to make choices that furthered that direction. So when we talk about does life have a purpose, the person exploring that for themselves and coming to some judgment about it, hopefully, I think they come up with the judgment that in fact life does have a purpose because their Shen can be strong and guide them in making good choices. If they come up with the determination that life has no purpose, I think it's harder then to have strong Shen. Maybe you can become an Epicurean and think that the purpose, in that way it does have a purpose, it's just enjoyment or whatever, but still I think this is something part of our spirituality issue, is exploring what is the purpose of life with our patient. Here was this question that I by the way, you have this in your packet so you can read it at your leisure, but here was this question. Some display poster art of Taoist or Hindu gods, famous Chinese medicine doctor fashioned into gods. To many, these are false idols. This was the kind of concern being written up in the journals, but personally, I think you can't be other than who you are. If these things empower you in some way, feel good in your clinic, I say, I don't like to judge. Do that. In fact, I do it. I've been a Buddhist practitioner for many years. I like to have some of those things around. I don't think that my patients seem to like it. I don't push these issues on the person. But here are 4 guidelines offered by the modern AMA about entering into religious discussions with patients. Physicians may enter into a dialogue, but they are not obligated to do so. I think it's a good idea. Dialogue must be at the invitation of the patient, not imposed by the physician. Of course that's true, but don't we need to sometimes initiate the possibility of this type of dialogue to show our interest in it? So I like to ask sometimes leading questions. Do you have any particular spiritual tradition you follow? Or I think is an inoffensive question. And you're feeling out, allowing that openness, showing your interest. A lot of times patients come to me and say, I want to talk to you about something that I couldn't talk to my Western doctor about. I say, oh, it's interesting. You couldn't talk to them. Oh, yes, he's not interested in those kind of things. Or, oh, he might think I'm crazy. Or, oh. But if you were to approach that physician and say, oh, your patient was afraid to talk to you about this. Your patient thought you weren't interested. He'd say, really? That's not true. I'd be very open to that. But somehow he miscommunicated with them. Probably because he only had 9 minutes allocated for his interaction, right? That's what a lot of these HMOs now are allocating, 9 minutes per complaint. So for example, there are many physicians who, if you have more than 1 complaint, you have to schedule that when you call in, otherwise you can't talk about that. That gives the wrong message to the patient. If you say, oh, I have you down because you came in for your back pain, now you want to talk about your depression, you got to schedule again. Ooh, but That's a circumstance that modern medicine has fallen into, right? Where there's a lot of time allocation based on the scheduling and the number of complaints you have, and so forth. So we have to be careful that we present an openness and let people know that we've been talking about sexual issues here. I really like to display an openness to the patient about this. One way I do it is on my intake form. I always have a few open-ended questions on the intake form, like the person can rate some things on a 1 to 5 scale, like rating how they feel about their job. I don't get more definite than that, but you rate it 1 to 5, with 5 is unfulfilling, and 1 is unfulfilling and 5 is very fulfilling. How is their sex life? And again, like that, and it gives the person, it's an easy way for them to slip in, oh, my sex life is a 1, or some people write in a 0, and then it allows you then to initiate a conversation, right? So as I said, the dialogue must be at the invitation of the patient. Yes, you're not going to push it on them, but on the other hand, you have to have that initiation of the possibility of the dialogue. The physician must be open and non-judgmental. We've already talked about that. Their beliefs are personally helpful to them, but of course they're never ultimate truth. The question is, can we ever reach ultimate truth? I doubt it, because we're stuck in dualism. That's our nature. If we weren't, even people who like to say, oh, I really see things, and there are a few practitioners out there on the lecture circuit who are now speaking about, oh, I see, when I interact with, I see from the unified principle of oneness. Yeah, right. I'm unconvinced. They have their own particular bias. As one of my old Buddhist teachers always used to joke. He says, people who talk about seeing from the perspective of oneness, I usually hit them. That's what he says. And when you hit them, they don't like it. He says, if it's all one, what's the difference? Actually, he should hit them 30 times, is the tradition. In the Zen tradition, I always say you give you 30 strokes, but he always says, I hit them once. Right? And then he always says, well, you might know 1, but you don't know 2. So I always think that's a nice comeback for that. But as I said, there are people out there on the lecture circuit talking about that. So whether we can know the ultimate truth, we can certainly often give the person counterbalancing. As all the Buddhist teachings are lies, I think all spiritual teaching can counterbalance something that's not working for the patient. And of course, the dialogue should be burden-lifting, not burden-producing. And I think we can extend this, as we've been talking, to all manner of counseling to the patient. We don't want them to feel, oh, they can't possibly do in their life what's necessary to be healthy. I always like to be cautious about this in terms of giving lifestyle guidance. As I say, I like to change their nature first, let them find their way and make better choices. I don't like to put, especially we should think about this if we get into pediatrics. I see many people tell parents to do things they can't possibly actualize in their life situation. We need to strategize how to step by step overcome problems and objections as you move towards a more balanced life. There's these mnemonics that you might think about when you interact with a person on the spiritual level. Again, these are from the Western tradition here. Does the person have a spiritual belief system? Do they have a sense of personal spirituality? Even then down to T, terminal events planning. Do they? These are interesting issues to explore with patients. Do they have a spiritual view that produces hope, meaning, comfort? Are they part of an organized religion? Do they have personal practices that seem to support them? And do their personal beliefs affect their view on what kind of medical care is acceptable? So that's this other mnemonic. So these are some of these sort of modern issues that are being ventured in our discussion of spirituality with patients. Now I'd like to move a little bit from this pure discussion of spirituality to a little more clinical discussion of the patient comes in with so-called spiritual crisis. They are in some kind of emotional state from that. We need to interact with them in some way to balance their Shen. So let's think about the mind in Chinese medicine now. I always want to be a clinician, and so I want to now bring this down to the more grounded level and say, how does the mind function in Chinese medicine? There is the conscious mind, and the conscious mind, this is the part that when we turn our observer, the conscious mind has the potential to be observed inwardly. And so we have our, in a lot of traditions, we can call this thing our mindfulness, our ability to watch our own conscious process. And what can we watch is our conscious mind. And then there's the below conscious level. I hate to use the Western term of subconscious, but it's sort of apt here. And this conscious mind has the seeds of behavior. The seeds of behavior are set by our constitutional nature that we inherited in some way. They're also set by whatever it has been going on already in our conscious mind. Every time a thought moves through the conscious mind, it has the potential to implant a seed of behavior in the below conscious level. Therefore, Chinese medicine is historically quite cognitive therapy-like. Modern cognitive therapy says you should focus on where you want to be and try to behave in that way, rather than this sort of analysis model of where we need to root out the sources of our behavior. Chinese medicine never seemed to emphasize that we need to discover the causes for our mental issues. Instead, we need to practice the way we want to be. And it comes from this view of the mind. If, for example, like I had a patient, very funny case of a woman come to me and say, you know, I've really been struggling with issues of anger. And anger, I just have anger management, I've had anger management problems for years. I've been going to counseling, and through our discussions with the counselor, I've come to the realization that I have really had issues with my father this whole time. And these repressed issues with my father are what keep erupting as anger and is driving the reason that I can't be balanced in life and can't restrain anger. And I say, oh, that's such a great understanding. Has it helped you at all? No, not really. And I said, well, what did your psychologist suggest to you that you now have reached this understanding? And he said, oh, what I should do, what he suggested I do, she said, was I should get things like magazine pictures and stuff that show men of a similar age or body type to my father, and take a scissors and just cut those to pieces to really release my anger at him. I thought, oh, how interesting. Has that been helpful? Oh, no, I'm getting angrier more than ever. He said, the more I do that, I just get really in touch with that. She said, in a way, I like it. Yeah, she's exercising her anger. This is actually totally contrary to Chinese medicine thought here. Because every time you run that thought through your conscious mind, you implant more seeds of anger. Wouldn't she be better off exercising her patience? Chinese medicine has given a lot of thought to this kind of thing. What are the opposition emotions that if you have anger, or you have worry, or you should practice those things so that you implant the seeds of consciousness for that type, and they crowd out the weeds. They crowd out them. So this is an interesting view of how the mind functions. So you use your observer, your mindfulness, to try and change what's running through on the conscious level, and therefore implant seeds of behavior that are more helpful to you, more in accord with where you want to be. Could be, let's say, take the example that I want to have more self-confidence. Of course, we would say a lack of self-confidence has an element of fear in it. we should strengthen the kidney. Chinese medicine would say then, for benefiting the mind, we should encounter those circumstances that generate fear, try to do it in a way that it's manageable, and then by interacting with them and in your mind developing a sense of, I can overcome this, this is a minor form of the challenge. For example, people have those common phobias of public speaking or whatever. What about speaking to a smaller group, more friends, whatever, but rehearsing that overcoming of that phobia? This is perfect for putting that positive effect in the conscious mind, implanting those seeds of confidence then in the below conscious mind, and then that starts flowering out later. Of course, we'll talk about in a minute ways of treating to help with these emotional aspects. So we have this structure of the mind. And then this mind is riding on the qi. And so we say the mind can be disturbed in 3 categories. We can have mind agitated, mind weakened, and mind clouded. Various Chinese words get associated with these 3 categories. For example, sometimes instead of using shen here, being agitated, they'll use zang fu, agitated, but they're specifically speaking about the heart, implying that the container for the shen is the agitated thing. So depends on the source text you're looking at. But we basically have these 3 categories. Mind agitated is generally a result of heat. This heat can come from all the possibilities. It can be true heat. It can be empty heat due to yin deficiency. It can be heat generated by qi stagnation or generated by phlegm accumulation. In any case, whatever the underpinning is, the heat is what agitates the mind. This implies any mental state of high affect falls into this category. For example, anxiety is mind agitated. Worry is mind agitated. Mania is mind agitated. So for example, when we talk about a bipolar patient, when they're in the manic phase, they're clearly in then the mind agitated category. And you need to moderate heat. Whereas mind weakened, these are any disorders of low affect. The person is withdrawn, shy, depressed. They're unable to bring the mind forward. This we certainly see there actually is the category of mind weakened called shen withdrawn, and this is a big component of a lot of autistic behaviors. And isn't it interesting now, we've talked about adults getting diagnosed with attention deficit or hyperactivity. A lot of adults are now getting diagnosed with some low-level autism. I just had a friend, in fact, Chinese medical practitioner, really smart guy. His PhD was actually first in some kind of biological behaviorism, something like that. He did a lot of study on what are those really small chimpanzees? There's 2 kinds of chimps, right? There's bonobos. Like he did a lot of, the bonobos are a very interesting type. They're a smaller type of, there's two strains of chimps, and the smaller one are called bonobos. And the bonobos are unique in primates in that they use sex as, you're back to sex again, you think I'm a sex man. But the bonobos use sex as the main way of social bonding and interaction. So they're always masturbating each other and stuff. Whenever there's a conflict, that's how they resolve conflict. So it's a very interesting culture, the bonobo culture, So anyway, here's this fellow, high-functioning individual stuff, but was having some psychological challenges, was dealing with some issues of shyness. He was going to his to a counselor, and they moved him on to a psychiatrist who gave him a diagnosis of low-level autism. Very interesting to hear that kind of diagnosis. But anyway, autism has as its prime component, Shen withdrawal, and then it has, of course, a lot of the next of Shen cloud, which we'll get to in a minute. So anyway, weakened mind is the withdrawal of the mind inward. You see the shyness, you could see the depression or whatever. Could just be general tiredness, that kind of, you know how chronic fatigue, the border between depression and physical fatigue is so vague sometimes, you know. And so this usually implies deficiency. And the main deficiency is usually qi deficiency, but of course it also can have blood deficiency. Once in a while, even yin deficiency. Usually yin deficiency turns to heat, the empty heat, and so you often see people with yin deficiency mind agitated. For example, yin deficient people cannot mask stimulus. That is, we all need to mask stimulus. Like this room has stimulus. This thing is making noise right now when I'm lecturing. It has a fan in it. As I get yin deficient, that kind of annoys me. I'm trying to talk over that. If I'm not yin deficient, I don't even pay attention to it. I forget about it. We always see this with older people, right? As they get more yin deficient, everything bothers them. Those dang kids in the neighborhood, those barking dogs, that's all yin deficiency. As younger people, we get yin deficient not so much structurally, but at that qi level of yin deficiency. And then you see younger people say things like, I can't wait to get home from work to take my clothes off. They don't want to flash the neighbors. They haven't become naturists all of a sudden. But they don't like the sensation of their clothing on their body. It bothers them. You'll see yin deficient people have trouble wearing jewelry. That bracelet bothers me. Those rings, I can't wait to get those off. That's all this inability to mask stimulus. How about ear ringing? Everybody's ears ring some. Of course, with enough heat, you get loud ear ringing. But a lot of people complain of low-level ear ringing. What they really have is yin deficiency. You tonify their yin, their ear ringing's fine. You say, do you still have it? Well, let me see. Oh yeah, it's there a little bit, but I don't even pay attention to it. That's the, you know. So yin deficiency easily goes over to that heat and therefore becomes the mind agitated. But qi deficiency, blood deficiency, is always the sensation of being overwhelmed, mentally overwhelmed. So that is a kind of mind-weakened state. I just can't keep up with everything. I just can't, I have too many responsibilities to meet them all. I can't take care of my family. Right away you know there's blood deficiency present, more than qi deficiency, when it's that general sensation of overwhelm. In fact, we often can observe it physically in the person. As my old mentor, I mentioned my old Korean mentor would always say about this. Person with blood deficiency, they can't look nice. They can't look shiny. What he meant was, when you try to pretty up for an event, you make yourself shiny. What's shining out is your Shen. If you're blood deficient, you can't do it. You comb your hair, you put on nicer clothes, you still don't have any radiance about you. Tonify the blood. That's what's going to support the Shen. Remember, your mind has to lie in the heart blood. If there's no blood in there, the Shen is overwhelmed, feels overwhelmed, is not comfortable. So blood deficiency is a common pattern under mind weakened. And there is a false appearance of mind weakened when we have qi stagnation. This is the same phenomena that happens when a person with qi stagnation has fatigue or has cold limbs. Very commonly, the person comes with chronic fatigue, and you see, oh, they're tired, their appetite is reduced, blah, blah, they're getting sick frequently, and you give them tonic treatment. If you're doing acupuncture, you start burning a lot of moxa here and there on the back shoe points, you moxa stomach 36. In fact, that patient often comes back to you and says, I don't know what you did to me, but I'm more tired. That's the clue right off. Same way with herbs, you start giving a lot of qi tonic herbs. After all, they're getting sick a lot, they're tired, poor digestion. Okay, I'm going to give them Dong Shen and Baiju and all these kind of qi. The same thing happened. It didn't help me at all. I felt bloated. I felt this. They have qi stagnation. They've diagnosed. You've diagnosed by treatment, right? It gives that false appearance of deficiency. And then, of course, once you start to talk to them, you realize that, oh yeah, all my fatigue started as I was under a lot of stress. Rather than depleting the qi, it constrained it. So this happens with the mind. So normally we say Shen weaken, mind weaken, is qi deficiency. But we certainly see a significant number of patients where there's also underlying qi stagnation, like a depressed patient or a chronic fatigue patient or whatever, who the qi is blocked, so therefore it doesn't bring the Shen out. Then finally, there's mind clouded. And this is where the behavior is more disturbed, more irrational, more not supporting to the person. We often see a mind agitated person is the one who gets mad too easily, who yells a lot, but the mind clouded is the person who, they're yelling for no reason. You see it with kids, right? Kids get really mad. Some kids are like weird. They're checked out. There's like nobody home kind of thing. That's a more mind clouded. As I say, you do see this with a lot of autistic kids. Why Shichan Pu, Hoshiam, those aromatic herbs are so useful for. Now, if you ask about how to treat that with physical treatment, how do we clear that phlegm obstruction strongly with like an aromatic? We use like the Sifeng points, for example. Very useful in autistic kids. They may not like you for doing those because that's a sensitive area. Of course, then we have to follow our pediatric rule, save anything uncomfortable till the end of the treatment, because you lose cooperation after that. Mind clouding. Why the Sifeng points? Why aromatic herbs? Because what produces mind clouding is phlegm. This phlegm gets in the mind. So phlegm in the mind, all those names. Phlegm clogging the orifices of the heart, and the theory of that is the Shen's in the heart. It looks, why does the heart have tubes connected to it? Not to pump blood. Chinese medicine simply did not know. If we look at the physiological discussions, people like to lie and say Chinese medicine knew about the circulation of blood before Harvey said that in the West. No, they didn't. Chinese medicine thought that the reason there were tubes in the heart was so that the Shen could look out through those tubes to the outside world. That's why phlegm clogging the orifices of the heart means the Shen is looking out through dirty windows, tubes clogged with phlegm. It can't see the outside world clearly, therefore your behavior is distorted. That's the mechanism. Okay? So what do we use? We use herbs that are, we use a Sifeng, pericardium 5, of course, combined with other phlegm clearing points like stomach 40 and gallbladder 34, as we mentioned earlier. That's the thing that's going to allow the mind to start to look out clearly. Then we want to think about the mind is not just in the heart. Yes, it has these three categories, but also the mind depends on the brain. People often say, oh, but Chinese medicine doesn't think the brain's important. Oh, that's not exactly right. It's just that they didn't think of the brain in exactly the same way we do in the West. They didn't see it as the seat of consciousness. But it's important because the brain is the marrow of the skull. Just like the spinal cord is the marrow of the spine. The brain, as the marrow of the skull, is therefore the biggest pool of marrow, and hence is the sea of marrow. When you learn the 4 C's in the body, places where there's a reserve of some kind, you learn certain points that are the boundary of that sea. So for example, the sea of yin, the sea of nourishment. Does anybody remember the points that are the sea of nourishment? I didn't think so. Because you usually study those things in school. I'm sure you had to memorize them because everybody's concerned they'll be on the exam. And then you promptly forget them. The reason is you never got a good sense of what are these for. What they're for is they are boundaries around an area of reserve. The sea of yin, of nourishment chi, of nutritional chi in the body, is actually the thigh bounded by by stomach 30 at the top and stomach 36 at the bottom. So those 2 points regulate the sea of nourishment. It means this region between those 2 points is where you put your nutritional reserve. Therefore, if a sick patient, we often see this in elderly people, loses weight in the thigh, it's a bad sign. Their nutritional reserves are low. And we do see this with certain people with chronic disease or aging or this or that. They start to get muscle wasting. They lose their thighs, bad sign, because the sea of nourishment is now empty. By the same token, you learn the sea of marrow. The points for that are things like do 16, do 23 and 24, do 20 could also be included, even do 26. Where is the sea of marrow then? It's in there somewhere. It's boundaried by those points. And so when thinking declines in clarity or force, you always want to fill the brain. That is, you fill up the sea of marrow. When you look at the indications for the sea of marrow point, there are things like diminished sensory perception, loss of memory, stuff like that. So the brain is clearly recognized here, but just under the guise of this repository of deep strength, the marrow. That deep, remember, you were burning bones in ancient times to drive the spirit out of the animal's bones. Your marrow in there has a lot of your spirit in there, a lot of your mental function processes through the brain. So when we have issues affecting the mind, we certainly want to treat the sea of marrow. Points, as I mentioned, do 16, do 20, the 4 points around do 20, the Shishen Kong points. Do 23 or 24, people argue about which one or the other. I don't think that matters. They're so, close. Do 26. Why does do 26 recover from fainting? Because it activates the mind by invigorating the sea of marrow. In fact, modern studies show that stimulation on do 26 actually increases blood flow into the brain. Of course, it would help for fainting in that way. But it has a lot, often elderly people, when you stimulate do 26, they actually will tell you spontaneously, oh, I see clearer. And when you question them carefully about it, it's not that they focus better. Things just look brighter. As we increase the sea of marrow, all the sense function going in is enhanced. So, how about in this mind issues, we include sleep disorders. Mind agitated is often insomnia. Whereas, as you mentioned, mind weakened is your, hypersomnia, where you're too sleepy, heavy eyelids, can't wake up, could even go to some forms of narcolepsy. Just falling asleep. I had a funny patient a while back, was a massage therapist, and he would fall asleep on his patients. He got no tips. He'd be working on the person's back, boom, fall down on the patient asleep. Well, you see that with narcolepsy. People fall asleep into their food and things like that, right? That's clearly as part of mind weakened. But I tell you, a lot of those patients actually have qi stagnation, not deficiency type patterns. So it's a false appearance of mind weakened in that way. They have the qi, it's just stagnant. And then what happens, it suddenly moves, and that's where it triggers them to sleep. That's why they fall asleep so suddenly, right on. They're working, they don't feel, boom. It's almost like a seizure disorder. Wind goes up at that moment from the qi stagnation. Yes,
I was just going to say, I actually had a client that, according to the way you're categorizing it, had hypersomnolence and then just one independent symptoms that kind of fell into the general category of liver cheese.
Yeah, so as I say, be alert for that. I see it a lot in depressed patients. It really was actually this particular patient I'm thinking of, which is fortuitous in a way because it's often easy to move qi as opposed to build up deficiency. So he responded quite well in treatment, and in fact is a very popular teacher of massage in San Diego. Was actually the founder of a massage school there, has a big practice. But there was a point in his life before I treated him where he was just practically rendered dysfunctional by the fact he'd fall asleep on his patients. He wasn't bored as I say, he was a person who really was thoughtful about massage methods and so forth. But
your mention of D26, should we, on ourselves or on patients, stimulate D26 like you stimulate
You betcha.
36?
You betcha.
Just as a matter of course?
Well, as a matter of course, just because it is a sensitive area and so forth, but certainly in those patients where it's warranted, when they have unclear thinking, when they have really any of these mind disorders, but particularly for the mind weakened state, it's important. Like I mentioned I think earlier I was talking about treating through the cheek. I needle points like Do28 for hemorrhoids a lot. And that's acceptable to patients. You just have to, so Do26 could be acceptable, and I think it is a good point to include. It has a lot of function. It's the middle of the man for no reason, and so it's not just to reserve for, fainting or some kind of revival point.
And then back to when you give the point combination for the insomnia, was that tonification?
Oh, back when I said way back when I mentioned stomach meridian points to drain down the yang ming.
Tonification.
It's really neutral stimulus. It's the idea of treating the bottom of the yang ming to make downward.
Yeah.
So I probably would sedate them because it's still an idea of opening, dispersing out of that meridian. They always say the yang ming, being full of qi and blood, is a good meridian to sedate. So you might as well do that down, dispersing, downward draining effect.
This might be too specific a question, but let's say you've got somebody that you're treating for a mind weakened state and they are so hypersensitive to needling. Do you have any recommendations in terms of that and any kind of ideas about why that might present? Yeah, because as you become more deficient, as we saw in our constitutional type of the lesser yin type, which is the very most efficient of the type, you become sensitive to everything. You feel the impact. The more excess you are, boy, if you haven't done much pediatrics, you'll see this so clearly if you start treating kids. Excess kids come in, it's so easy to move them into needling. They don't care. You needle them, they don't, whatever, okay, stimulus them. Deficient kids, oh my goodness, it's much more challenging to make them comfortable with the process of being needled. And so I think so my clinical trick, and I think it makes your treatment work better, is if the person is so deficient that they're hypersensitive, try to find ways to start to increase their qi. One trick, moxa on points like triple warmer 4. I always find that people with really weak pulses, maybe the pulse actually scatters under pressure. You put moxa on triple warmer 4, there's more available for your acupuncture. And I think it diminishes their sensitivity. Give them some kind of qi tonic herb to take before treatment. That's a nice trick. You don't do herbalism, doesn't matter. You can give some simple qi tonic teas that they drink before they come in for the treatment, like a half an hour before or something. My teacher's favorite was to simply use Lijiang Tang, ginseng, ginger, dates kind of mixture. That's a very simple formula, easy to actualize for the patient. And so they take that before treatment. The acupuncture works better because there's more qi available. So those kind of tricks where you build qi first makes the person less sensitive to them. Could you spell out the name of that?
Lijiang Tang? Yeah. Strengthen the middle soup. T-A-N-G, So Lijiang Tang is a ginseng and ginger combination. It really is that. It's a good digestive formula anyway, but in this case, we're just using it as a general mild qi tonic. So we're thinking about the brain as part of this regulating the mind. Let's take this now and think about insomnia for a minute. This is a good example for this. If the person can't sleep, since we mentioned earlier the Yang Ming, I sort of thought about discussing insomnia. What is it that makes it possible to sleep? The first thing is we have to be able to exchange yin and yang, upward and downward. What is the actual process of falling asleep? The yang descends, the yin ascends, and when the yin covers the yang, the sensors close, we withdraw from the outside, our mental activity turns instead of being outward to inward, and we dream. This is the mechanism of sleep. And how does the body exchange the yin and yang? It does it through pathways, the yin and yang chow mai. So if you want the person to fall asleep, the yin and yang chow mai have to be able to exchange in this way. So we can always use these things in any case of insomnia. In fact, the yin and yang chow mai meet at bladder 1, which is said to be the reason your eye closes as you fall asleep. That's the descent of yang. Your eye opens as you wake up. That's the rising of the yang. Why do we feel the sensation? We even use the word in English. I fall asleep. The falling sensation is the descent of yang. If you have that sensation of, I'm falling asleep, whoop, I wake up. I'm falling asleep, whoop, I wake right back up. That's excess yang. The yang won't descend. It keeps popping back to the surface. People sometimes feel like I'm falling asleep. They catch themselves. Better sedate yang. Use the yang chow mai to do that. Points-wise, to be very specific, you could use bladder 62, kidney 6, and bladder 1. Or if you don't want to do bladder 1, you can use bladder 2 with pretty good effect. And this just facilitates this possibility of exchange of yin and yang. Then, in order for this yin and yang to exchange, we already mentioned it earlier, there has to be free flow of qi around the neck and shoulders. So let's put here, relax neck and shoulders. So anything you do to relax there, whether you like to do hand technique and massage that with tuina, whether you want to do cupping, whether you want to do gua sha, or maybe you want to choose specific points, like we have An Mian, Yi Ming, all these extra points that are said to help sleep. They're all right along this area. They release the neck. That's their main function. And they make you sleep better. An Mian, after all, means peaceful sleep, right? But nobody can agree exactly where they are. You consult 10 different texts. They all have different locations. The point, because it doesn't matter where they are. It matters that they're on the neck and shoulders, or that they release the neck and shoulders. So I don't care the location. I'd much rather put my hands on the person, find the tight points, and needle that. But I facilitate then the possibility of exchange here. Then, third thing is, of course, the descent also is happening via the Yang Ming, and we already addressed this. Using points on the Yang Ming could help, at least making sure there's no food retention. Food retention will always interrupt the ability of the yang to descend, therefore you can't sleep. That's why eating at night is disturbing to sleep. Eating spicy foods at night, even worse. Right? Drinking alcohol can disturb sleep because alcohol heats the stomach. Makes heat in the yang, makes damp heat in the Yang Ming. Chinese medicine correctly observed that alcohol is directly absorbed through the stomach. It doesn't go into the intestines. Yeah, they say, actually in the Neijing it says, that alcohol is the refined essence of grain. Therefore, it enters through the stomach. That's exact. That is correct. How they, maybe because they knew how fast it affected you or something, but somehow they observed that, and it heats up the stomach. So we want to make sure that we treat the yang ming in some way to make sure there's no food retention. I mean, you have so many options for that, whether it's you're giving an herb formula. So you could actually say, is an herb formula like Baohuan good for insomnia? Yes, and will cure insomnia a lot of times, because if for that particular patient, the main reason they can't sleep is there's food retention in the stomach, Baohuan suddenly becomes a Shen calmer. It makes a possibility for the yang to descend by clearing the stomach. Then we have to make sure that the sea of marrow is full. We've been talking about that. Means the brain is functioning normally. You can't have normal sleep rhythm if the sea of marrow is empty. So we can fill up the sea of marrow. My recommendation is moxa on DO20. Terrific thing to do to help sleep in a lot of patients, especially on two categories. Children, I tell you, you have kids who aren't sleeping through the night. Teach the parent to do moxa on DO20. They will bring you gifts because the child will start to sleep. It's so counterintuitive, isn't it? We're worried about yang rising. And yet, moxa on DO20 in this case makes the brain function normally. The sleep rhythm really regulates. Kids, it works well. And elderly people. Old people who come in with that, I'm waking up at 3 in the morning or 4 in the morning for no reason, can't go back to sleep, tired all day then, and you think they should have yin tonics. So you're treating kidney 3, 6, and 10, you're giving them, Liu Hui Di Huang Wan, or I don't know, whatever, Tianwan Buxing Dan to connect heart and kidney, and they're not sleeping. Try moxa on DO20. They often start sleeping better. So counterintuitive, but the principle is you've put normal substance back into the brain. So you'll like that because it's very helpful. Finally, after doing all this stuff, can we concern ourselves with some other organ syndromes? And the 3 principal organ syndromes to be concerned about, there are actually 4, but the 3 principal ones are heart and kidney aren't connected. This is the one that has some yin deficiency in it. So usually you tonify kidney, calm the heart that way. I recommend points-wise things like heart 3, kidney 3, use the back shoe point of both organs, bladder 15 and 23, to connect the organs. If you're going to use an herb formula, the correct one is Tianwan Buxing Dan. That is Heavenly Emperor Tonify the Heart Elixir. This formula, by the way, is not as good now as it was classically because we leave the cinnabar out of it. And so therefore it's a lot less stabilizing to the mind. Now I can't say I'm sad that they leave the mercury out of it, but how do we supplement this? Add to it heavy minerals like oyster shell and dragon bone. So Longu and Mu Li are a good addition, Tianwan Buxing Dan, and they bring back some of the heavy stabilizing effect. Now those of you, again, not doing herbalism can learn from this and right away give minerals to your patients like heavy calcium type things, like, for example, these mineral source calciums that they sell like dolomite. Okay, I know that some people say dolomite contains other things, but it's a calcium mineral thing, that's fine. For as much as you're going to use it for this, the important principle is, or maybe you can give oyster shell or whatever, but we add it to this herb formula, makes it much better, brings back some of its stabilizing effect that gets lost in the modern preparation.
One of the easiest fixes I ever had for insomnia that was due to food retention was Tums with calcium.
Ah, nice. Yeah, Tums with calcium, regulating the heat in the yang ming by reducing the stomach acid, calcium weighting down the shen. So that's a kind of cool thing. It really fits the Chinese medicine model here. by the way, thinking about that, instead of calcium carbonate form of calcium for stomach ulcers, Chinese medicine has historically always recommended hai piao xiao. Hai piao xiao is cuttlefish bone. That's really great for promoting healing of the stomach lining. And it's real easy. You can just get that, and it powders very easily. I use to powder like herb tablets and stuff. I often use just a little coffee mill instead of a big herb grinder. Don't use the one you make coffee with for this, because you grind cuttlefish bone in there, your coffee's going to taste fishy for a long time. But have a separate one for grinding your herb. So you just put you can steal it from your parakeet if you want, right? So you take the cuttlefish bone, you put it in the coffee, it turns to powder. You can stick it in some capsules. Oh, that's the greatest thing for healing the stomach lining. There's the mineral salts besides calcium in that. There's magnesium salts, and it really promotes the healing of the. And if you combine that with Huang Lian, then you get the double effect of healing the stomach lining, reducing the excessive stomach acid, plus the Huang Lian kills the excessive H. pylori bacteria that's in the stomach ulcer. H. pylori bacteria is actually a normal part of flora. People who have no H. pylori bacteria have a higher risk of stomach cancers. Yeah, modern medicine has recognized that now. They used to think H. pylori was always an invasive bacteria. But in fact, they've now found that there's sort of a normal level. And people who have none are actually not normal either. So it's only when you have an overgrowth that it's creating that stomach ulcer inflammation. So it's an interesting issue. Right? But when you have a person who has a stomach ulcer, you can always give a little Huang Lian, clearing stomach heat, and that pushes down the... But be careful. People with stomach ulcers, they have stomach heat, yes, but they may have some spleen deficiency. So you may want to supplement, tonify the spleen too. It's not always a question of just cooling off the stomach. They may have liver overacting on stomach. Be sure you take the big picture. But as far as healing the stomach directly, hai piao xiao, the cuttlefish bone, Huang Lian, those are good things. So in regards to using Tums, you might also think about, and people with really irritated intestines, like in colitis, the cuttlefish bone helps that too. It helps heal that irritation in the intestinal wall. You might even try it in, you have people with compromised immune systems, and they get that diarrhea, and it's just this watery diarrhea, and and the Western guys are trying to treat them to kill organisms, thinking, oh, there's some kind of diet. Try the cuttlefish bone. Just put it in capsules. You can get one of them Captain Quick things, and just make a bunch of those cuttlefish bone capsules, and it really seems to heal the inflammation. And of course, from a Chinese medicine functional perspective, hai piao xiao is astringent, so no wonder it stops this liquidy diarrhea. I know that's a bit of a digression from insomnia, but so heart and kidney not communicating, not connected, is one of our common patterns. The second one is liver fire. Liver fire rising, disturbing sleep. This is usually the acute upset thing. I'm overthinking, upset about a particular issue at that moment. And so we need to draw down that rising liver heat. So liver 2 is your main point for that, of course. But herbally, you have all your cooling liver formulas. I usually like to use Jiawei Shayasan. To move the liver and draw down and clear heat. Some people use any other liver formulas, even as much as Langan Shegan Tang, something like that, to draw down liver fire. The third type is the spleen qi deficient, heart blood deficient type. That's your excessive dreaming disturbed, excessive dream disturbed sleep, or waking up more often, or whatever. It's the spleen is not producing blood, and therefore the heart blood is not there to calm the shen. And of course, this is your Guipi Tang herbal formula fits this. But points-wise, it begs a big question. How do we use acupuncture to generate more blood? And I want to, so I'm going to put here a very simple prescription. Stomach 40, spleen 3, 6, and 10. Very good heart blood, I mean, a very good spleen tonic to make blood combination. But later, we're going to look at production of blood much more in detail. So keep that in mind. This may not be the only, or may not be the important point prescription for a particular patient. Now, I said there were 3 types, main types of underlying syndrome for insomnia, but there's one lesser type, and that is external heat evil agitating the pericardium. This is the situation when the person has had an external evil attack, typically generates fever. Their sleep is disturbed, they get better, but their sleep never improves again. What's said to have happened, it refers back to our very beginning of our discussions today when we were talking about hidden or lingering evils in the body. The heat has entered the pericardium or is disturbing, harassing the pericardium. It's probably actually back in that Gao Hong area. But the mind never relaxes after. You know, we start to see that even when the person has fever. How many times have you had a patient who gets kind of dingy on you when they get a fever? Like a very normal person, you know them, they're very rational, all once they start saying crap like, do you think I'll ever get better? Is this something very serious? Oh my God, you're like, you have a common cold, it's going to be fine in a couple of days, and yet they're all in a panic. They have heat harassing the pericardium. That heat, that fever has made them, and we see it in kids a lot, they get real clingy. They're like hanging on you, hanging on the parent. That's the heat in the pericardium. And the interesting thing from this point of insomnia is sometimes that heat stays even after the fever's gone and the person has ongoing sleep disturbance.
Would you expect maybe to see an increased incidence of insomnia in people with pericarditis?
Oh, you bet. Yeah, for that same sort of reason there, I think we can make that connection. Physical organ construction of the pericardium would heat there like pericarditis would. And in fact, I've often been surprised how often herbs that clear heat and toxin not only help the pericarditis, but make the person so much calmer and less anxious. So anyway, that's a sort of a less commonly talked about type, but it's something you do encounter clinically of that person has the residual lingering heat evil in the body and it's disturbing the pericardium. And so I think this gives you a certain structure then to, when you go to regulate sleeping, you can regulate a lot before you're worried about a Zangfu diagnosis. And often you hit the right place of obstruction here. You don't need to ever treat the organ syndrome. Because if the big point of obstruction is the qi can't descend because the neck is tight, if you get that working, body balances. You never have to get to the fact that the spleen is a bit deficient or whatever. The body, you sleep better and build up your qi again and you make enough blood and everything's good. I might add one little detail on this before we go on, to say that something you can give to relax the neck and shoulders is the herb combination Chai Hu Guizhi Tang. I like to mention this formula in my lectures a lot because it's a good neck maintenance prescription. Blue pleurum and cinnamon soup. I call this the anti-chiropractor formula. It's for that patient who only feels good if they get their neck adjusted regularly. So when I say anti-chiropractor, I don't mean anything negative towards chiropractors, because even they themselves typically say, I don't like to over-adjust this person's cervicals. They start to get unstable. And yet the person only feels good with that. These people often become self-adjusters. You walk into the treatment room, they're doing that. oh, it's like stop that, because typically if you don't aim the adjustment, you're adjusting the wrong spots and everything's getting stretched. And give them Chai Hu Guizhi Tang. Regulates the small collaterals in the neck, therefore the neck maintains its normal flow of qi. I mean, you could certainly adjust this formula. You could add Gogun, you could add Chuan Shan to make it even better. But no matter, if you're just doing simple herbalism, you can always use a prepared form of blue plurum and cinnamon soup. Will benefit the neck. And I think it's particularly good for women. Because women having less upper body muscle mass than men typically get more neck deterioration later in life. I recommend you should all carry baskets on your head to help prevent that. But it's not in our culture to do that, so instead we can take a Chai Hu Guizhi Tang to maintain the free flow of blood through those collaterals in the neck, and the condition there is just stronger. So, okay, so that was a little bit of a look at insomnia.
Can I ask a quick question?
Of course.
The use of moxa, head and neck. I've heard different theories on, obviously the way heat affects the blood. How do you justify, moxa on dew point?
Most of the time, moxa, in the way I was taught to use it and the way I observe it clinically working, is that it restores normal qi. It provides zheng qi to the body, and therefore it tends not to be so overheating. There may be particular circumstances. For example, the person who already has a lot of empty heat rising because they're so yin deficient. If you then moxa their head a lot, maybe it's too warming or drying for them. But that's not most of the cases. Even in these elderly patients who have insomnia, and you say, yes, they're generally yin deficient, mox at the top of their head, not to excess. I've never seen a problem from that. In fact, how about this treatment? An older person with that yin deficiency hypertension. They're the ones who often have the flooding pulse. The old guy comes in and tries to get up on the table and breaks into a sweat. And he's panting a little bit. He's got those red blood vessels in his face. And you think, oh my God, I hope he doesn't die before he gets out of the treatment room, And then you take his pulse. And you say, but gee, his pulse is pretty good. Better than mine. No, of course it can't be. His pulse is flooding. It shows the empty heat on top of the yin deficiency. And if you take his blood pressure, it's really high, then you recognize it from that flooding pulse sensation. In that patient, if you put moxa on dew 4, the empty heat is pulled back to the kidney. He's much stronger and his blood pressure goes down. But his pulse goes away. You think you killed him. Oh, I was worried about him dying. Now there's no pulse. He's dead. No, his pulse is now showing the true deficiency condition. The empty heat is brought back to the kidney. So I think moxa can function like that. You didn't overheat or make more heat go up. You actually bring the heat to. We see the same thing herbally with cinnamon. Cinnamon is a warm herb and yet can be used in hot patients because it directs the heat where it belongs. So I think of moxa as very much having that nature most of the time.
Just what I view moxa more maybe as warming. I guess I don't always look at it as heating so much. I don't know if you
It's
would say
warming,
that's, like,
yes,
more
but more importantly, it's replenishing normal.
Right.
And so with that attitude, I think you can use it quite widely in this way. Because as I say, kids are excess yang by nature. They're not sleeping, yet moxa on dew 20 helps them. It can't be overheating in that case. It just wouldn't work, and it does work easily.
And then as far as application, I'm thinking maybe the sticky ones.
On
What would you
kids?
do?
On
Just for the
On
hair.
adults, I don't care what method
just
is
direct?
your normal clinical thing. On adults, they can tell you if it's too hot, and you can manage that easily. But on kids, I always prefer moxa stick, even though there is history of using more direct moxa methods. You burn a kid once with moxa, you're not going to get them to let you do it again very easily. So use a moxa stick and keep your hand in the way. so that you're monitoring the amount of heat they're getting. You know, this is not a pediatrics course, but there's so many aspects. Never light a moxa stick in front of a kid. It scares them. You're there trying to get it to light, you know, and sparks are flying off. Light the moxa stick. Say, I'm going to warm up your head, and you pull that out and you start that, no problem. You know, and then you don't burn them, no problem. Then you tell the parent you can do that at home, and no problem. But you know, it's a scary thing, and then you bump them on the head with it, and then you lose all the compliance. You know, so it's kind of an issue like that. Find a way to make it acceptable to the kids, and they don't make it. So many things are like that in pediatrics. I pull out the otoscope. If they've never had it before, they don't know what it is. No problem. I pull the otoscope out, and that kid goes ballistic. I know some other practitioner has mishandled them. Typically, they're pediatrician. He's in a hurry. He wants to look in there and get out of the room. So he jams that thing in the ear, and the kid's crying. If I'm the first one to use an otoscope, I take it out, I show it to the I got a flashlight. Look at that. You know? Then you get the kid to present their body to you. I start to look for their ear. Kids love that. Because here's a stupid adult, doesn't know where your ear is. So I'm looking at, where's your ear? Do you have an ear? Let me see it. I put the otoscope down on their knee. They go, dude, my ear is here. And they stick their, and I put the otoscope in. I'm not chasing them around the room trying to put an otoscope in there. They're going like this. This otoscope goes in, no problem. You know, that's the kind of thing that when we talk about the therapeutic relationship, you want to work on that kind of stuff with kids, and then you can, so with moxa, same thing, make it accessible to them. It's no big deal. We mentioned bedwetting earlier. Getting moxa on the sacrum is good in bedwetting. I teach the parents to do that. But I always use a moxa stick because I don't want to burn them. You mentioned giving herbs to kids too. Since we're talking psychology a lot. Modern society has an unfortunate attitude a lot of people have embraced. Any negative sensation should be avoided at all costs. It's a very unhealthy attitude. Life will naturally have certain levels of discomfort. In fact, ancient cultures revered the person who could withstand negative sensation. So many stories from Chinese culture about this. For example, we mentioned Hua Tuo as one of our lineage ancestors. There's the famous painting of Hua Tuo doing surgery to remove an arrowhead from the shoulder of some general, whose name I forget at this moment. And the general's sitting there looking at a game of Go, Weiqi, distracting himself. And the saying goes that the general was so strong in his shen that he never changed the expression on his face while Hua Tuo did the surgery. Now, Hua Tuo was said to actually have an anesthetic that he could use during surgeries. But this general, when he climbed it, I have to stay alert. So he distracted himself by focusing on the game. And you see him, the painting of that as he's sitting there and Hua Tuo is behind him doing the surgery to remove the arrow. So this is an attitude of ancient culture. He's so great, he never changed the expression on his face while they removed it. Modern thought doesn't go like that. So parents, they get protective of their kids. Oh, they don't like it. Oh, it doesn't taste good. Who cares? It doesn't taste good. It's over in a second. Who cares they don't like it? It's not an option. And so I often encourage parents, you need to be in control in this circumstance. To tell the child clearly, in this situation, I'm making the determination that this is not optional. You're just doing it. That improves the parent-child relationship a lot. To me, that's a spiritual treatment right there. Making them take the herbs, not what the herbs are. The parent learning that, in fact, I can make my child do something that's good for them. I can be in charge sometime. That's such a revelation to some families. My kids, they survived me. They're 26 and 24. They knew when they come to tell me they had some symptom, they already came with a glass of juice because they knew some nasty tasting herbs were just coming. You're telling me you got the symptom? No problem. Here's the herbs. They're drinking it. It was nothing. It just was part of their life. It was just normal. And sometimes you do something like that. I was never a strict disciplinarian. But there were, this time you just do that because it's the right thing. And this is lacking in modern society for a lot of families. So we need to sometimes help counsel. I don't like to tell people what to do, but can't give the kids herbs? Who's in charge? You know?
Well, the parents are trying to be their friend more times.
Yeah, that's right. And really, the parent-child relationship is different than the practitioner-child relationship. It's different than friend. Even Confucius said, different kinds of relationship. Parent-child, ruler-subject, friend to friend, different kinds of. But you have to maintain all of those. Parents are not the child's friend. They need to provide guidance, clear discipline, structure, order in the child's life. Then the child's liver relaxes. Otherwise, they get all these liver problems, and then that leads to the Shen disturbance as the liver, the Hun gets agitated. Okay, now we talked about insomnia. Let's think similarly about depression. Such a I have some statistics on that here. Let me look for my. I put something in your packet on depression. Let me find my. Well, here's some interesting numbers. The number of ambulatory care visits for depression in the United States in the course of 1 year, 21 million. Wow, it's a lot. It is not true that there's no depression in China, even though it's not very highly reported. If you look at the World Health Organization statistics there, the Chinese report a whole lot of other things like neurasthenia. And if you total all that stuff up, you end up with the same amount or even more depression in China than there is here. But people there tend to somaticize. They don't feel good in their body. They're tired. They don't want to go to work. They're blah, blah. They're actually depressed from another perspective. If a Western psychologist would see that patient, they'd say this person's clearly depressed. In China, they're not getting that diagnosis, but issues are the same. So there's a lot of depression, as we all know. Now, the main issue in depression is it's a situation of mind weakened. Therefore, you would think that either qi deficiency or qi stagnation underlies it. Right? That was our principle, that mind weakened has qi deficiency or qi stagnation. Possibly blood deficiency, but not so much in depression unless it's postpartum. We'll come to that. So, since depression is mind weakened, the first thing we could do is bring the person's affect back up. Bring their mind up and out. And so regardless of the cause, it's very helpful to raise the yang, especially in the dumai. Raising the yang in the dumai will bring the weakened mind or the withdrawn mind back out. The way we do this is to do a series of points along the dumai. Now, of course, you could use another kind of lifestyle treatment. For example, Chinese medicine says getting up early every day and cleaning your house is a lifestyle cure for depression. So that's an interesting homework exercise for people. You have to get up early and clean your house first thing in the morning. Clears your depression. But what we can do in a more practical treatment-based way is we raise the yang and the dumai by doing a series of points up the dumai. And you want to start low, work your way up. It doesn't matter much which points you choose. As my old mentor used to say, do the points you remember along the dumai. But be sure to do 16 and 20. Another variation of this, simpler but a little weird, is to just do strong stimulus on do 1. Raising the yang up to do mai. I prefer a series of points. It's not as weird. Oh, you're depressed, take your pants down. I'm going to do a big stimulus on do 1, conduct qi up the spine. But instead, we just choose a low point down, maybe do 2 or 3, do 4, do 6, do 9, do 12. Those are the big points that you use a lot. You just do that up to do 16 and do 20. And then even more if you add moxa, starting at the bottom, you use your moxa, the needles are in place, you use your moxa stick, you warm the lowest point. When that one's warm, just move up to the next one and the next one. Raising the yang like this is a very powerful antidepressant treatment. Regardless of other factors, this will in itself bring the person's affect out. And people will typically say, after you do this treatment, oh, I feel such a lift. I just feel like doing things again, because raising the yang qi helps the mind weaken state. Then the second aspect is to move the liver more. So we said, so here in a sense, we don't have to diagnose, is it qi deficiency, qi stagnation? We sort of harmonize both aspects. We've raised the yang, that benefits the qi, and then we move the liver, points like liver 3 and liver 14. Now we get qi really, really, as my teacher used to say, this is actually more like softening the liver. It just makes the qi move smoother. It certainly helps release frustration in a person. So often depression moves through that pattern of constraint of emotions to frustration to depression. And so softening the liver helps the depression. Then, the third step, harmonize the Shen. Some of the things we can do is we can use heart 7 paired with other points depending on how we observe the patient. Heart 7 pairs well with pericardium 6 when there's yin deficiency. That's why we use that combination so much in insomnia. But heart 7 pairs better with pericardium 5 when there's confusion, because pericardium 5 removes phlegm. Heart 7 pairs well with heart 3 when we want to get the heart blood in there to keep you calm. That's when you're dreaming a lot or anxious or something like that. By the way, I would pair, in this case, if there's anxiety, spleen 1, not pair, but then add to the combination. Spleen 1, so useful for anxiety, also for other kinds of overthinking. It's where the earth meridian touches the earth. Very grounding in a certain sense. Very good. Isn't it interesting? Spleen 1 is both lifting the central qi and yet calming the mind. Kind of produces that. Heart 7 pairs well with, in this case, we say heart 6, but what I do is I needle obliquely and sort of get heart 4, 5, 6, 7 right there all at once. This is good for heart qi deficiency. Might be a very useful thing in depression, bringing the qi level up to bring the mind out. Just sort of take an oblique insertion and you'll just go along those points. If there's really a lot of heat, now this is not common in depression, but might be common in bipolar. Bipolar, very often it's the qi stagnation of the liver which occasionally turns to heat that causes the cycling. When the stagnation predominates, depression is there. When the heat predominates, mania is there. So something could be tipping the person back and forth between these. Usually you regulate the liver and control heat. So normally in depression, we raise the yang like this. But in bipolar, think about using something like Jiawei Xiaoyao San, which cools the heat at the same time it moves the liver stagnation. And think about that with your points too. You're going to circulate qi, but descend that empty. You know, the liver is very prone to that, isn't it? It's stagnant and then heat can erupt up. How about those patients that like to talk about sex today for some reason? So how about those patients who get orgasmic migraines? Every time they get an orgasm, they have a migraine. What a kind of a disincentive for sex, right? That's actually liver stagnation with heat.
It's a little different than honey, I've got a headache, honey, I'll get a headache.
Yeah, exactly. It is that. People fake a headache so they don't have to have sex for some reason, but sometimes people want to have sex, but as soon as they have the orgasm, pow, sets off the migraine. It's the same phenomena as the day off migraine, the first day of vacation migraine, those kind of things. You relax the liver qi, and that's when the heat flies up. So when there's heat in the liver, and this is really the nature of bipolar. So we have to control the liver stagnation and pull down the heat. Then we balance both sides, the depression and the mania. It's particularly interesting to start working in this realm because now they want to even pre-diagnose kids with the tendency towards bipolar with brain scans and put them on meds even before they show symptoms. This is what modern medicine is thinking about. Let's treat those kids, so they don't take those strong psychoactive meds. Anyway, so we always want to harmonize the Shen, and I like to use Heart 7. We can even use Heart 7 and Shen Men in the ear. By the way, back to insomnia, I forgot to mention this. People with really distorted sleep rhythms, up all night, sleep all day, and stuff like that, run electric stim between Heart 7 and Shen Men. Another use, here's a different use of electric stim. But I tell you, this really helps to re-regulate their sleep rhythm. Shen Men in the ear, Heart 7. Run your electric stim on that. Quite nice effect on regulating sleep rhythm. After harmonizing the Shen, we should think about, is there other, as you see, this is the way I tend to always do these progressions, do I want to do any other organ syndrome that fits the patient? Make sure you think about, does the spleen need tonified or whatever? And lastly, we should say, if the person has postpartum depression, then we should think about tonifying blood, especially liver blood. A couple of good points for that. Liver 8 and 9. Liver 9 is so important postpartum because liver 9 regulates blood into the uterus. The name of that point, yin bao, implies that, right? It's the uterus point. This is a bit of, I know our time is just about up, but I'll just add here. In the postpartum situation, the first thing to do is to clear stagnant blood. I said something earlier, just in passing, I remember saying, oh, grandmothers know in Korea to give the mom after birth soup with kombu and a protein soup with kombu and sanchi. Those herbs, kombu softens hard masses, and of course it's a source of minerals and all that too. And sanchi removes blood stagnation without causing more bleeding. And that's what you need. And technically, though, since grandmothers don't do this, but since we know, when you feel the pulse after a woman has given birth, it's typically choppy. And you continue the sanchi until the choppiness leaves. Could be 3, 4, 5 days. Then you switch to blood tonics. If you give tonics right away, maybe can provoke more bleeding, maybe can turn to heat because of the blood stagnation turning to heat, stuff like that. It's better to clean first, 3 or 4 or 5 days, and then turn to your tonification. And this is sort of contrary to what some people do. They just right away jump into tonification. And you see these recommendations. Oh, a woman gives birth, just burn a lot of moxa on the lower abdomen and the lower back and all of that. But do think about moving the blood stagnation first.
So the choppiness is in the liver?
The
position or
choppiness
could-
is probably in the uterus, but because the uterus is so closely allied with the liver, you
Okay.
often access it through the liver.
Okay.
In fact, when we talk about where is the liver in Chinese medicine, it's in both the middle and lower warmer. The qi spreading aspect of the liver is more in the middle. That's why it affects digestion a lot. So when we have liver qi stagnation, we get bloating in the middle warmer. But the liver blood storage aspect of the liver also is in the lower warmer. And in the case of women, where is it storing the blood? In the uterus.
But I was
So-
asking on the pulse itself. Are you
Oh,
feeling?
you tend to feel it fairly general, not just in the liver
Okay.
position or anything. You'll feel a general choppiness in the pulse.
Okay.
It switches from the smoothness of slippery to the roughness of choppy after the birth. And you want to clear that first by moving before you go overtly into full-on tonification. And you'll avoid. But in the case of the postpartum depression, you have to get to that tonifying blood. That's what supports the Shen, keeps the person from being depressed. Okay, so that's our discussion today for generally the spirituality, and I tried to finish with something really clinical where we then turn to the
Yes, it
mental
has all
disorder
this energy.
side of things. So hopefully that was good.
Easy to
Tomorrow,
get it
those of you
out.
coming, we're going to talk about nourishing life. We're going to start with, I don't know, the 27 or 28 aspects of nourishing life. You know?
Good, thank you.